actually. So I'm Sylvia. I didn't introduce myself. Sylvia Kamphuis, Zetkin Sahin, the secretary for everyone I think well known. Zetkin actually prepared the whole meeting, so all credits to him. And we start actually with like housekeeping, well, not housekeeping, changing the board of the Working Party. And I'm not sure, did you all receive the email with the candidates? And are also new members or non-members here? Did everyone receive the mail with all the candidates and the proposals? Not? Oh, you didn't read maybe the mail? You didn't receive? It's been sent this week. Again, because we had to, we'll show it here. Oh, where are you? Right away. So we have.
Should we collect an email list?
Again,
maybe
yeah.
Email to us or Selcan.
Yeah.
I will also show her email in the next couple of slides. We have asked all of you, all the members in our email list for the following positions, and we have Ms. Oleg's friends applied for these positions. For chair position, Eve Smith, she was our research lead. Only she applied for this position. Congratulations, Eve Smith. And for secretary position.
So applaud to Eve. And maybe to introduce a bit, so there's a 4-year period. So this is actually, it's not that I don't want to do it anymore. I have to smell it. I'm really happy that Eve is going to take over. You know, 4 years is long enough. And I've been around a long time. So Eve, you're really welcome. And I'm sure you're going to do a great job. So that's, and also the second thing is also because Zetkin has done 4 years.
I also completed my 4 years, my term with Sylvia, thanks to her.
You were a great team.
Thank you very much. Yeah. For secretary position, Selcan is also here from
She's in the back.
She also was in our board. She was in clinical lead position. Selcan, would you like to introduce yourself, Selcan?
Hi, I'm Selcan from Turkey. I was working in the Lupus Working Party for 1 year. I was leading the clinical pillar with Elena. We worked together. And now I just wanted to take more responsibility and hopefully I will be successful.
Actually, we different from other working parties. We have 2 colleagues in every pillars.
Thank you, Sasha.
In research pillar lead position, Koziana will continue her job, and then we, Katerina and Emiliano applied for this position, and we finally decided to include both of them. So we have 3 leads in our research pillar positions because it always helps us to make our meetings with necessary number of colleagues, because we have experiencing illnesses, or everybody is doing a lot of work in their clinical setting. So much people would always beneficial in our work to be done. In education pillar lead position, Eduardo Marani here.
Hi, everyone.
He only applies for this position. Congratulations, Eduardo. Would you like to say something?
I am Eduardo Marani, pediatric rheumatologist from Firenze, Italy, and I was the emerger representative for the last 2 years, and I step up. I mean, in a certain way, I'm so happy to collaborate with all the other people from the council.
Yeah, so this happens when you get active. Because then we ask you to stay on, and you happily, you know.
No, I was happy. You asked me, and I was happy to answer.
And please, Katrina, introduce yourself too. So this is Katrina Buchalova.
My name is Katerina. I'm from Olomouc, Czech Republic, Polski University. And during last 2 years, I served as educational pillar lead co-leader position, and now I've applied for research one.
Hi everybody, my name is Emiliano Manasco. I'm a rheumatologist in Rome, and I've been part of the Lupus Working Party, but this is my first time taking an active position. I'm very happy. Thank you.
Nergis from my center applied for the empty position of Eduardo, so I'm a representative. Just only we received application from Nergis. Let's continue.
Is Nergis here? No.
No.
No. So let's applaud all new members first. I'm really happy. And I think maybe because I'm leaving, I have the urge to tell something, but I'm thinking I'm really proud of our board because we have a patient representative, Sammy, who's already here. He's also here, but you don't get to stand up because you're still staying. So it's really good. We have a nurse representative, we have pediatric rheumatologist, we have eMERGE representative, and now we have an adult rheumatologist. So they're the best team to to go on. Thank you.
If we pass the election process and decided new positions, then our next topic, we have 5 presentations on research. The first presentation will be made by Eduardo on an international study on macrophage activation syndrome in childhood onset lupus. This is a new project. Eduardo.
Yeah, sure. Hello everyone. I have already introduced myself. This is this project is born as a bridge between as a joint activity between the MAS Working Party and the Lupus Working Party. My proposal is to address the unmet need in macrophage activation syndrome in lupus. Macrophage activation syndrome, it's a rare complication of childhood onset lupus, and the diagnosis is it can be really tricky because most of the manifestation of both the diseases can overlap. In 2009, an international effort from the Lupus Working Party led to the development of preliminary diagnostic criteria by Parodi and Angelo Ravelli group. After that, no other activities within the PReS community has been allowed, has been set. In 2021, a Canadian group released new preliminary criteria, and these criteria increased the threshold for the diagnosis to the same threshold as the Ravelli group, the Ravelli criteria for SOJA associated mass. And in these 14 years, almost the treatment of these patients has changed because of the introduction and widespread use of biological agents and other new novel treatments. So we need to know what is the status of the heart of the treatment of these patients. So the aim of the study is to collect clinical and biological data at the onset and during follow-up of these patients, and to map the up-to-date treatment modalities of such patients, and describing the overall prognosis. Patients with both a diagnosis of lupus according to the SLEEK criteria or the ACR Euler criteria will be included, and a concomitant diagnosis of MAS according to the available set of criteria, because not all the use of the Parodi criteria we don't know yet if they are in use nowadays or they are be replaced by the SOJA criteria, the Ravelli criteria. And clinical characteristic and treatment outcome will be evaluated and collected on data collecting form. So the aim of the study is to identify the clinical feature in disease outcome in these patients, and to identify the negative prognostic factor for such patients, and to improve the overall prognosis of these such complicated patients. So thank you for your attention.
Stay, Eduardo. Is there a question from here? Eduardo, anyone would like to join? Maybe. Yeah.
Okay. Yeah.
Thank you very much, Eduardo. Maybe we can put, for example, viral infections. It's called viral infections.
Yeah. Because of the time, the time limitation of a working party, I didn't get inside all the protocol. I write a draft of the protocol to be shared between all the centers, because we need also ERB, a central ERB approbation, I think, even if it's not required for retrospective study all around Europe or other countries, but it's for other countries it's mandatory, so I need to apply for ERB, and so I'm working on the final exclusion criteria, leishmania or the viral infection. So we can. I am happy to get comments and from all the audience and all the center who are like to participate. Thank you.
Thank you very much. Any question? Okay, thank you very much, Eduardo. We will invite you a second time. Then the next speech will be on new functional brain MRI in children with lupus. Katerina, please.
Thank you. We can move slightly slides. This is a new project, and at this phase, this is just the pilot study and feasibility phase of this study. We started to prepare protocol with Department of Neurology and Department of Imaging, and as you can see, and you know, neuropsychiatric disease is a severe disease, and it encompasses a lot of different, really different clinical manifestations, and compared to first year, during time, up to 95% of children might have these problems. So we decided to slightly uncover this area, and we were helped by a new publication, which is mentioned, the fourth line, Rumetzhofer and his collective published recently data on lupus patients, adult lupus patients, and they used the protocol which is described for analysis of these patients, and interestingly, they found that separate groups were based on this functional MR. So we are open for discussion from anyone who has some experience with functional MRI, because from literature we know that it hasn't been published any consistent theory. So thank you for your attention.
Thank you very much, Katerina. Any question from audience?
So just to say that our hospital is getting a new research MRI scanner, so I'm sure that we'd be interested in being involved in this study. But there is some work, I think, going on between Brazil, Ian Bruce in Manchester. I think there's other people that are doing work in this area that'd be worth reaching out to find out, you know, what sequences they're using, what they're doing, building on what they're doing, potentially collaborating.
Yeah, we had some delay due to Corona and organizational issues. We're starting, as you know, not functional MRI, but just basic MRI in the whole group of lupus patients, irrespective of symptoms or not. So it's really wonderful that you're starting this, and you should collaborate with. Indeed, in Brazil, there is some functional, but not much in children. It's mostly adults, and it's all small groups because it's pretty expensive and difficult. So I think it will add up very much together.
Thank you for a comment both from Eva and Sylvia. And I can add that our imaging specialist has done some attempts to do this in adults many years ago. So we just skip in this project and try to develop a functional protocol that would be functional for our research, because we know that classical MR, normal classical MR doesn't mean that the patient has no neuropsychiatric disease.
Yes.
Phil might know about Lupus work.
Yeah, I think really it's the same thing, because obviously it was Simone, I can't remember her surname now. I'll look it up. You know, so Simone came over to Manchester, actually sat in some Pete's room clinic that Eve and I do together in Manchester. And she had a scientist, didn't she, working with her that was doing a lot of work, looking at the images, and you know, it was a lot of really interesting work they were doing. So there was a lot of scientific background to it, and computing background. Yeah, it was quite interesting what they're doing, and I'm sure there might be a crossover with what you're doing. So I'm sure we can. It's terrible. I can't remember her surname. Yeah, Simone Appleton.
Ну, это хорошо.
Thank you very much. Any question from here? Thank you very much, Katerina. And the next presentation will be from our guest from USA, Sarah Stein. She will talk on Sjogren's disease registry, a new project. She's looking for collaborators from PReS. Thank you.
Thank you so much for giving me the time to come to PReS. I co-lead the International Sjogren's Work Group and the CARA Work Group with Matt Bashega and Scott Lieberman. And we wanted to give you a little bit of an opportunity where we could work together and do something really special. So, do these children have Sjogren's disease? You have a 7-year-old girl who's seronegative, has recurrent bilateral parotitis, an ultrasound consistent with bilateral parotid and submandibular gland inflammation consistent with Sjogren's disease, and recurrent dental caries. How about this one? A 15-year-old girl with a high positive ANA as well as an SSA, joint pain and fatigue. Okay, so now, I think we should. So if they don't have Sjogren's disease, who does have Sjogren's disease, and will they progress to Sjogren's disease? And what exactly is childhood Sjogren's disease? So, working together with internationally, the Sjogren's community has already, in the childhood Sjogren's community, been able to make a lot of magic. And I think that by working together with PReS more closely, we can even make more magic as quick as we can. So we've published 300 patients retrospectively to see how many satisfied the 2016 ACR-EULAR classification criteria. We looked at provider perspectives on childhood Sjogren's disease. We developed diagnostic algorithms to help practitioners that don't know as much about childhood Sjogren's disease sort of figure out what needs to happen to get to childhood Sjogren's disease with the knowledge we know. And we looked into the CARE registry to see what medicines we're using. And we're using a lot more medicines than just plaquenil or hydroxychloroquine. So there is an opportunity that we decided we needed to do, even though it's hard and it's going to be long. But in order to answer the questions we want to order, such as develop a classification criteria for childhood Sjogren's disease, figure out the risk of malt lymphoma so we can tell our patients what is the malignancy risk when their child gets diagnosed with Sjogren's, we need to work together. And we have developed a prospective registry that Matt is the leader at the Mayo in the study, where we're going to look at 4 different types of patients. First, people who meet Sjogren's disease children based on the criteria. Second, recurrent or persistent parotitis without an underlying diagnosis. Third, those patients that you get in clinic that have the high SSA and SSB and you don't know really what to do with them. And we just say, you have an SSA and an SSB. Come and see me if you have dryness, right? And then fourth, patients that you presume have Sjogren's disease, even though they don't really meet the criteria yet. Another opportunity that you all have is to become involved in the international work group, the Sjogren's work group. I think we're an amazingly fun group of people, and anybody who can help advance childhood Sjogren's, there's so many questions to be asked, and we need to work together to answer some of them. So, if you're interested in participating in our registry, which is called CHOSEN, Childhood Onset Sjogren Disease Outcome Network, we really need your help. And you can contact us. If you don't like QR codes, I have cards. But anybody who participates, of course, you will get your name on anything we publish. And once again, I feel like we need a united front so we get a really good picture of what childhood Sjogren's disease is, so we can be as advanced as lupus. Thank you.
Thank you, Max. Maybe there will be questions from the audience.
I'd like just thank you so much for being here, taking the trouble to travel all the way, and great work. I just wanted to add from my position as a working party coordinator that there's also an application, as you know, for the Sjogren's syndrome working party. So for the PReS members and everyone who wants to join, there's going to be a European counterpart working all together. Actually, they applied for Sjogren's syndrome, so I think we should align the names a little bit, maybe better. But they're talking about it, and they'll for sure. Did you have contact with them already?
Yes, and we're going to try and figure out a meeting where we can all meet together.
Because the expertise on childhood Sjogren's disease, I feel like you need as much opinions as possible so that we can do it in the right way. We want to do it right, and there's a lot of questions.
And specifically, as you said, we all have those kids with recurrent parotitis, where there's lots of them never come back. You know, it's been here for 20 years. I haven't had patients that came back to me like, "Oh, you stupid doctor, you didn't diagnose my disease." So there is quite a spectrum. So I think it's really an effort worth to do. So thank you for coming.
Yeah.
Any questions?
Thank you.
No.
Thank you.
Any questions? No questions? Yeah.
Вторая, это получается Sjogren disease, тоже американка какого-то, тоже хочет изучать Sjogren у детей именно. Слушай, редкая же штука. Она говорит, вот посмотрите, есть дети, у которых двухсторонний паротит. Да, и постоянный кариес, двухсторонний паротит, а по УЗИ пишут, что это Sjogren. А есть дети, у которых SSA, SSB положительный, и нет симптомов. Только типа...
It feels like it's almost part of almost like a pediatric phenotype with Sjogren's and Lupus and aquaporin for neuromyelitis optica, whether that's part of
Вот
the
она
registry.
хочет педиатрический фенотип Sjogren disease. То есть как педиатрический... Да, Sjogren в СКВ.
The data we're collecting at baseline is just clinical manifestations, laboratory data, diagnostic test results, and that is one of the variables that we're looking at. And then it's longitudinal, but it's also a convenient sample, you know, so ideally we want patients to come every 6 months and have, you know, data entered, patient-reported outcomes entered, but we also understand that we have limited funding right now, and it's just an effort of people that are really interested. So there are some, you know, basic minimum data elements that are required to be collected, but yeah, we are asking about that. And I know there have been maybe 1 or 2 small case series just reporting that, you know, what you notice with NMO. Sjogren's. So.
And with the diagnostic algorithm, there's a systemic and neurologic pathway. So we're trying to create more understanding that the neurologist, anytime they get somebody with neuromyelitis opticum or MS, they have to think about Sjogren's.
Question from the back.
Ну, для детей это же редкое. У них есть QR-код, ты типа можешь зайти по этому QR-коду, сделать регистрацию пациента. И пациент, мы можем как бы сделать, они хотят регистр сделать. Они могут взять таких детей, просто регистр.
You would like to use RedCap? It's very important for them. Okay, this is the first question. Same will be in the vasculitis working party. And I would like to say the idea was born during this year at annual CARA meeting in March. The CARA Sjogren's working group is working so hard. They are really perfect. And the idea was born, we should have the same working party, Sjogren working party, PReS, and of course, it is very rare subject and we should work together. So please include your patient. It should be international registry.
Question from here, I guess.
Okay.
Hi, thank you. Sounds really good. I was just wondering, for people who need to put this through their own ethics committees, do you guys have a pack just with a like a proposal and consent forms and data sharing agreements, just to make that easier?
Yes. We all ready to go with that. Matt has that all. If you email us, we will get it to you and we will work through the process. And he's at the Mayo, and it's
Yeah, so if you click on that QR code or email us, I have just a templated email that includes all of that. But we also have a SharePoint folder that basically we can give you access.
Online.
Sure. So if you're interested, you can email us with the email addresses there. Hopefully they can see that online. Or if you want to use the QR code, I have a templated email that I'll respond back to you with that includes all of the documents for your IRB application with the protocol, consents. We thought about doing a Reliant IRB, but that didn't work out. So you do have to have local IRB approval. Once that happens, we will set up a data use agreement with your site, and then we'll have a virtual meeting with you just to make sure everyone's clear on the inclusion criteria. And then we'll give you unique access to RedCap, and then you can enter the data directly that way. And the last thing I was going to say is, in terms of the international collaboration, I just want to point out that Eduardo had the first IRB approval of all the sites that are going to participate. So just want to point that out.
Congratulations, Eduardo. Thank you for all these comments, and we'll continue to the next speaker. Thank you.
Thank you very much, Sarah. The next speech, I would like to invite Koziana from UCF for an ongoing project of on cardiovascular risk assessment in lupus patients. Koziana, it's yours.
Thank you for having me this afternoon. I'm very pleased to be here, and especially to give you another example of international collaborations, even if this is a very, very simple idea of research. Because I deal with young adult patients with lupus, I'm very much concerned about their cardiovascular risk. I see them up to whatever age, because we run young adult and adult clinics. That means, why are we concerned? Because there is a clinical unmet need. We know they have increased cardiovascular risk, and that is estimated to be approximately 100 to 300 times. And just to put things into context, if you have diabetes, and we are very concerned about diabetes, that will increase your risk by 2. If you have hypertension and your hypertension is not well controlled, that will increase your risk in between 1.2 and 3.2 times. But if you have juvenile lupus, that can increase it up to 300 times. That means it's really relevant. If you are a young woman with lupus, lupus, which started in childhood, you may get your first MI at age 32. If you got adult onset lupus, that might be around 48. But in the general population, you may not get MI at all, or you get it in 60 plus. That means it's a big difference there, and we need to try to understand in which way we can predict and classify our patients better, stratify them based on risk, to be able to have tailored management strategies for them. Thank you, Sergio. That was our hypothesis, not at all creative. We wanted just to bring the community together and see if this is important, if it's something that pediatricians would think is something that we need to look into. And we defined young adults up to age 30 for all sorts of reasons. We know the cardiovascular risk is likely to be associated with age quite significantly. And we hope to reach a preliminary agreement in this survey. Next. Thank you. That means we had a 17-question survey that we disseminated via PReS and also CARA, and we asked clinicians, in particular pediatricians, and also people looking after patients with childhood onset lupus, to rate different items related to 3 different aims. And these were first one to try to see, if you can press the next one, Sergio, thank you very much, what tests they will do if they think about cardiovascular risk, what tests in particular they will do in their patients because they have lupus, and if they classify, stratify someone as being high risk, what they're going to do about it. Next one. So we had 170 respondents, and here you can see that probably our response date from the American colleagues was a little bit low. We particularly target those patients, those clinicians who are looking after patients. We wanted more than 5 a month to ensure that they are pretty much involved in caring after patients with lupus. And 2/3 were fully trained, 1/3 were trainees, and unfortunately we completely failed here to capture the live health professionals' impact and their opinions about managing the cardiovascular risk in these patients, although they are very important. You know, many of our nurses are looking after our patients. Next. Now, we received quite good agreement based on this reasonably small sample size, but we feel that it is quite representative because childhood lupus is a rare disease, and clinicians agreed that we should have a way of assessing patients with cardiovascular risk, and also that we need to address this because their risk is increased compared to the general population. Now, I'm not going to tell you about the results because we have an oral talk tomorrow, and that will include all the results. And what I wanted to do is just to end by bringing my thanks to everyone in relation to the conclusions that we've been able to reach. That was the first worldwide survey investigating the rheumatologist perception, and we've been particularly focused on pediatric rheumatologists. The top clinician priorities will provide some preliminary data from our work to move forward. We achieved some good consensus, particularly related to what we should do for our patients in terms of appreciating their risk, but less good consensus about how to treat this cardiovascular risk because of the lack of data in the general population. And the last slide, I think, is with my thanks, in particular the PReS Lupus Working Party leadership, Sylvia and Sergin, because they supported the dissemination of the survey, and also Cara and Laura Lewandowski was helping with that dissemination. Thank you very much.
Thank you very much, Kosiana. Any question from the audience? Thanks.
More a comment, but I think in terms of thinking about the different pillars of the working party, there's obviously quite a lot of overlap between research and clinical here. So I do wonder if this could be an area that both the chairs could sort of work together. I don't know, we've got lots of chairs. So all the chairs for clinical and research could work around thinking about, you know, the research aspects, but also in terms of screening and how we should be running, you know, annual review clinics, what we should be doing for children, providing some sort of guidance. So I think this could be a really good area in terms of thinking about projects that we could be taking forward in the short term.
Thanks a lot, Eve. This is amazing. I mean, we started this especially because we have no evidence to be able to guide our recommendations, and understanding what people are doing. Similarly, what Sarah and Matt did in juvenile Sjogren's, literally we need to understand first what clinicians are doing to understand the kind of a problem and the way we tackle it, and what are our opinions, because it's going to be very much a consensus-based recommendation. It's not going to be based on any evidence, at least to start with, and of course has a kind of educational component because we need to think about it, and we are pairing this with basic science research, because we know that even if we are to assess these patients in terms of what we know, that may not be enough, because the reason of their kind of atherosclerosis progression is not only driven by the factors that we take into account and we can measure in clinic. There might be other things to stratify them that we need to invest more research into. But I fully agree, we need to take it as a kind of educational aspect and clinical policy sort of topic for further investigation.
Thank you very much, Kozana. Any more questions? Thank you very much. I would like to invite Eve to talk on treat to target analysis across global registries in childhood onset lupus erythematosus.
Thanks. So this is a project that we've actually applied for. Sorry, this is a project that we've already applied for some funding. We're waiting to hear the outcome of the funding. And I wanted to flag it today because if we are funded, we'd be really keen to have more collaborators get involved in this. Even if we're not funded, then we'll look for other opportunities for funding to try and move this forward. So this is something that hopefully we should be able to do over the sort of short to medium term. And this very much builds on two different projects that are internationally collaborative projects. So the first is this PReS-CARA funded study. So this was the first grant that there was a sort of combined PReS-CARA grant where we were looking at trying to identify cross-registry commonalities to facilitate international paediatric lupus research. So Rebecca Sadoun, Jen Cooper, Laura Lewandowski, Alex and myself have worked together really quite closely over the last 3 years, meeting pretty much every 2 weeks to try and do a couple of different things. So one was to try and map data fields across different cohorts. So we have now pretty much mapped data fields across these 3 cohorts. And the brilliant thing about that is that if we bring all these cohorts together, we've got about 3,000 patients that we can use for clinical research. So that's pretty amazing for childhood lupus, where it's a rare disease. So we can ask all sorts of questions across all these 3 cohorts. The second thing that we did was work together with international experts to define core and expanded data sets for childhood lupus, so that if all cohorts take on these data sets going forward, we'll all be collecting the same things that'll make it easier for us to collaborate. So for anyone who's thinking about setting up a registry, that this would be a really good place to start. So on the basis of that, and then also on work that I've been involved in around treat target and childhood lupus, we were trying to think what could be the next question, what could be the next thing that we could look at using all these different data sets and bringing them together. Just move on. So we saw that there was a call from Foreum and the RRF for a combined project involving one PI from, it suggested one PI from North America and one PI from Europe, but we sort of bent the rules a little bit and sort of have put all of us on it because we couldn't differentiate who should be on it. And what we've said is that we want to use that combined data set to look at the impact of paediatric specific treat to target goal attainment on damage accrual, severe flare and key secondary outcome measures. So what we're saying there is that we now have paediatric specific targets that have been derived through the International Treat to Target Task Force, and we want to use these cohort data across 3,000 patients to see the attainability of these targets. If we get patients into targets from observational data, what benefits that leads to in terms of reduction of damage accrual, reduction of flare rates, reduction of key secondary outcome measures. The reason we want to do it across all these cohorts, so for example in adult lupus where they've been developing treat to target, they used a whole range of different observational cohorts. So this was like 10 years worth of research, individually all looking at these targets. But if we can all come together and do it once, then we can make it quicker to get the treat to target approach towards a trial and also into practice. The second aim is to interrogate these definitions that we've come up through consensus. So using a data-driven approach to try and interrogate them to see, are they good enough? Can we refine them in any way to make them better? And then the third aim is to use some machine learning to try and investigate personalised predictions of target attainment. So with the patient that you've got in front of you, from their clinical demographic features, can you predict when they're going to be likely to get into target? And obviously through using treat to target, you hope to get them there quicker. So that's the 3 aims for what we've submitted. We should find out fairly soon whether or not we've been funded. I think this is a very competitive programme, so we're probably, we'll be very lucky if we get it, but if not, then we should try and do it anyway. And we'd be very open for others wanting to join in with us. Obviously, there was a short timeline on getting the application in, but we would be interested in people joining us. Okay, so I've said most of this already. So this is a bit of information about the task force, what we've done, that we've developed these principles and points to consider, that we've got targets. Next slide. That we'll be using 3,000 patients. I've said all this already. We can keep going. So yeah, so in terms of very interested to hear from anyone who has other international lupus cohorts, anyone who hears of any relevant funding streams, and anyone who's actually already using Treats Target or targets in their clinical practice. I'd be really interested to speak to you. And I think this could also be a really good opportunity. So part of that call, you had to have patient research partners. So we had 3 patient research partners from the US and 3 from Europe. So this is again something that can support the working party in trying to bring together a critical mass of patients to help support these studies. Thank you. Any questions?
Thank you, Eve. You know, as always, you've worked so hard already on this to the target, so we're getting here somewhere. Of course, I'm very interested. And am I still here?
What's happened?
Probably this one. Yes, no?
I didn't touch anything.
That can be this one. But I muted this. Maybe the battery? Yeah, I'm just turn it on again.
I think it's running out of battery.
Yeah, it's the battery. Battery is just gone, so I'll have to shout.
You have to shout, yeah.
Because I use this during the year, and the same thing. It's completely empty. Yeah. Anyway, so I'll, you know, you say a treated target that you already use. The thing is, between a study to do treated targets and in clinic, I think it's different.
Yeah.
Because I think we published on lupus slow disease activity, and we had good results. And I think because we have a target in mind, it's not lupus slow disease activity because it didn't exist. But we treat our lupus patients to first, you know, be without steroids within like a certain time point, and every 3 months we evaluate. And so it's a clinical, like real life target. But I think it's interesting to have all of you, if you have something in mind, if you treat your patients consistently the same in your group, it can really help us see what works. Because I think in practice, with all the busy clinics that we have, we'll do the study. But in real life, maybe you cannot do all this, the childhood low lupus disease activity every time. But it's good to have like at least evaluation points like you do in all your patients. Like, you know, you start, you set a target at 3 months, at 6 months, and see if you can reach it. And I think you should be open to like many groups that have clinical targets already and send in the data. And send in outcome data, because that's what we really need. I would be happy to collaborate, of course. Yes.
Good. So we very recently set up a Treats Target clinic in Liverpool. I think we've had 3 clinics so far, where we've been, you know, talking to the patients about Treats Target, about what targets are, about what the approach is, about, you know, what we should be targeting for them specifically. And then we have been measuring everything that you need to measure target. We've got a spreadsheet to sort of document it in. We've got some functions to be able to chart whether or not they've attained target, and also whether or not they've the interim trajectory score, which is a score that the task force came up with to try and tell us if someone is stable, improving, or getting worse. So we've only just started this, and actually, you know, even though I had targets in my head before that, I do find that actually properly calculating the target has impacted on my decision making. Yeah. So I think it is definitely something that's worth doing formally. So although we might do it, you know, I think actually having it in paper, calculating it, does actually make a difference.
If you have this checklist to share,
yeah,
I think it will be very interesting for the group.
Yeah, and we're hoping to do it in Manchester as well. So we've been talking about trying to set up there in terms of having somewhere else that, you know, maybe hasn't been quite as involved in it, to try the tools that we've developed and things like that. And we're also talking to, so within our hospital, we have an innovation team that develop apps and these types of things. So we're hoping that they can help us to develop an app that could make it all easier, because part of it is, you know, the extra burden on the physician around having to calculate targets. But if we can make that easier, then it'll be more doable.
Yeah, and exactly. I just think, you know, don't be shy or modest, but put in your cohorts, because it's actually interesting to, if you might want to calculate in retrospective. If you I think we have all the data there to calculate our lupus disease activity data, because we collect a lot of data prospectively. So it will actually be a good checkpoint for us too, that we did a good thing to actually reach our target all the time. Yeah.
And thinking about how much they have been in target or not, and little things that you think actually that patient isn't in target because of that, but I thought they were doing well. It calls you to account. Let's say. Okay, thanks.
Sorry, Eve. Thank you so much. Thank you so much. We're just swapping rows, and they're sitting just in time, but without the microphone. Yeah. I didn't even try. Maybe Alex, you should look. I don't even know how to replace the battery.
I'm not sure I can.
We'll probably get a new mic, but maybe let's in time see whether. I'm sorry for the online people. I hope you can still hear us, but the mic is being replaced right now. Yeah, it's empty. But how do you replace it? I mean, the mic is working. Just use it. No.
It's working.
Now we see.
It's working, but it will be.
It's just dying. It's maybe I stopped it a bit. Well, we'll try it then until now.
I have an IT guy, but
Next talk is from Syria. We are moving to clinical projects.
Well, this is not really my talk. Is yours as well. It's a project from the GEAR. Does anyone know the GEAR? Everyone knows. So of course our American colleagues don't. And so I'm just going to introduce for the two of you, but I guess there's some more. So the GEAR is Juvenile Inflammatory Research Network, and it's being being started by Michael Hofer in Lausanne, Switzerland, with French. I think it was original French and Belgian colleagues, so French-speaking colleagues, and it has been going on for. I'm looking at Alex, as he was there from the start. I think 15 years right now, maybe 10 years, and it's actually great community. It's like complementary to PReS. It's people interested in collecting cohorts and also collecting research data to do studies, to use those data collect them prospectively and use them for all kinds of research studies. And it's been, you can find it at of course, a website, GEAR Research Network. If you just Google that, I think it's somewhere on the slides. I joined them, I think a few years ago. And we were really thinking, actually the whole CLIPS project started because we wanted to do something for all of us, not just for specific countries, but for everything. How can we improve? And it's basically because we just had developed the SHARE guidelines. I think you're all familiar with how to treat specific diseases. And among them, there's also lupus and PReS, so our favorite diseases. And the thing is that, if I go back to lupus, that many of you treat lupus patients, but it's going to be different in every country. And I think I'm maybe the luckiest one here in the Netherlands, because I can treat any patient with rituximab at day 1 of lupus. Just if I say it's a severe disease, I can treat 2 days of meclovenolide and then I can start it. Not that I'm doing that all the time, but you know what, if a patient comes in, we have, patients that fly in from Curacao, who has had 2 pills of steroids, who are bleeding, have thrombocytes of nothing. I'm just gonna give everything, including rituximab, the day they're arriving, and it's reimbursed. And I think we're in such a lucky position that we can do that. And I think a lot of people cannot do that, and even it's very different. So the whole CLIPS project, it's clinical practice strategies. So now I'm on it again. So hopefully, is this actually working? No, it's just for the online people too. Okay, so the CLIPS is clinical practice strategies. So it's not a guideline. It's not a recommendation. It's basically knowing of developing, that's the ultimate goal, developing strategies that can be used in the different situations, in the different countries. So it's like, I use the analogy for a cooking book. So it's like you have a French recipe, you have like the Dutch kitchen, you have like the Brazilian kitchen, you have all the different things. And we're doing that for 5 groups. You're seeing them listed here. So we have 5 working groups, I would say, but working groups. So we decided, a little bit smart, combining SMART together with diseases that need this strategy developed because it's so different in different countries. So that's how we came up to these 5, and it's come from an idea to a really large project, and I see many in the room that are involved already, and it would be really nice to have your involvement too. You will get it by email too, so please, again, we said it at the start, if you didn't receive any emails from us, there's something wrong. You can check your spam folder, because maybe they're there, but please email us, and your email is going to be at the end, I think, Sachkin, and then self-chance will be there too, or maybe self-chance we should do, and just say in the title, member Lupus Working Party. It will help our secretary to just, put your email to the list, because we've sent it out to like 65, I think, members. What do we have right now?
Yeah.
So there's something wrong, maybe that you weren't on the list, but please do, and then we can send out questionnaires.
Oh.
So I said the ultimate goal is to get these practice strategies, but of course, if we're going to develop strategies, we need to have your experiences first. What works, what are you doing, what medication is available. So that starts with questionnaires. And some of you already have filled in the questionnaires, but we actually stopped sort of spreading it in May because it's a very large questionnaire. We're now analyzing the lupus nephritis data for induction therapy. And in fact, Francina is doing it. It's Sarah. I don't think Sarah is doing that. But we're doing that right now. And we actually decided that it's too much all at once. So we'll just analyze the data. It will be part of the study. I'm guessing it's going to be published next year. Hopefully, it's going to be published. It's all the question when. But then we'll resend the questions, but now in chunks. So it won't take you more than an hour, because it was really the case. Because we were so enthusiastic to collect everything, but everyone gets tired. You have busy lives. So we'll just make it up in chunks. And please, again, enter your email. You can also now scan to request a questionnaire, but I would wait really to have our, is it all right what I say? Yeah. To wait till we'll meet again. So we will meet with our Lupus Working Party, Lupus Working Group at the end of this conference. And then we'll resend them. Because we all need you, and really send it out. There will be instructions to everyone you know, because we can only develop these practice strategies if we know what's going on.
We should stress that we are not developing a guideline. We are just taking a picture of which countries or which physicians are using in different circumstances. In, for example, lupus patients. For example, Beluma, for example, is not available in my country. It's available in Netherlands, for example. We are just wondering what the physicians are using in different circumstances. For lupus nephritis, we are wondering the induction therapy for this year, induction therapy, which treatments are you using? So this is a short survey. If you scan this, maybe we can send the email list again.
Yeah. And it's also important, if you scan it, this is actually a bit like the red cap, it's not just you can scan and you can do it. You have to actively apply them. If you scan, you get an email, and then you get access to the questionnaires. There's all this safety European rules, because it's a European funded project. So we'll get you there to get the chunk of the new lupus induction. Okay. Any questions, comments? Let's move on. I think we're good or not?
We are good. We are good.
Yeah. We have 15 more minutes for the last.
The next clinical project, it's not a project, it's just a reminder about the World Day. Semi is here. Semi, I would like to invite Semi to talk about the World Day.
These are the slides from last year that disappeared, so it's good to see them again, but bear with me because I can't remember what they were. So yes, just to remind you again that it's Word Day on March the 18th, just in case there isn't anybody in this community that's never heard that. We'll never stop talking about it, but it's so important and it's gaining momentum each year. So the purpose is specifically to raise awareness that young people get rheumatic diseases. I don't need to tell anybody in this room that. But it's just to spread awareness about the whole community, about every single health professional, every single rheumatologist, charities across the world, but crucially as well that parents understand that when their child is showing symptoms, it could be a rheumatic disease, so that GPs and those first-line doctors that they take their child to can be aware that it could be a rheumatic disease. So Word Day was established by a small steering committee 6 years ago now.
Yeah.
So yeah, time flies when you're having fun. But it was just started with a conversation over a couple of coffees that we wanted to do an International Awareness Day. It was the brainchild of Eve. She doesn't like that, but it was. And she got a small group of us involved. So there's about 5 or 6 of us that work hard on it, generally all through the year. But then as it gets past Christmas, we sort of live and sleep and dream about it all of the time, don't we? But we really need, it's not just about us, it's about the whole community coming together to really, really try and make it bigger and better every year. So what we suggest you do is to do face-to-face virtual events. We try and do some really good stuff in Liverpool where we're based, but each year we have 2 international webinars that are really well organised by our colleagues at MCI, and we reach out to the wider community to get different colleagues to come along and join us to answer questions, to give presentations, and to bring the whole world together, the whole rheumatology world together that day to spread awareness about Word Day. We have also a Word Day tweet chat thing that goes on for any of you that are on Twitter, and right from probably a couple of months before the day, we have a very big active social media campaign that we try to work really hard on. But again, we need your help with that because we can't write it all ourselves. It's got to be events and things that everybody's doing around the world. So please join us. But what I said to Eve when we were traveling here yesterday was I wanted to throw this back to you guys and to see whether there was anyone in the room that wanted to maybe share something that had worked on Word Day, or maybe something that you were thinking about the next Word Day, whether there was anything that you were going to do. The one event that always springs to mind happened in South Africa when people, when a group took a group of patients to the top of Table Mountain with the big Word Day flag. I think Eve and I were just dumbstruck when we saw that, to see it in such an amazing place. This year, we're going to try and get a group of patients and families up a really big, iconic building in Liverpool. So it might not be quite the same as Table Mountain, but Liverpool will try its best. But we just wanted to sort of throw it out there and say, have you done anything that you would like to share with us now? Or is there anything that you could think of? If not, I hope we've just given you a bit of food for thought so that as the day approaches, we can all begin to share ideas and come together as a community. So has anybody got anything they want to share of a schedule?
And we would like the Lupus Working Party to do something specifically. So we had sort of thought about it this year, but we didn't sort of manage to. But for next year, we really want to do something from the Working Party.
Before you all burst out in ideas, I'm going to stop it here because I think I wanted to add a few more things because we don't have time. Otherwise, it would be appreciated. We don't have time. You've seen the website. I would like to ask you, if we get all your emails, Sammy and Eve have this wonderful supportive material. So to actually use it, and we discussed it at the PReS Council. So, and we asked for admin support also to spread again. So MCI is the Congress agencies, but we're actually about to get admin support, just not from the Congress office, but just a secretary, which we don't have, to also give a big impact on Word Day. So the PReS Council thinks this is really important too. So pay attention to the website there. You will spread all the material you have. And actually, you know, we've been talked about it a long time. I think this is a great example. For me, I'm actually thinking because it can be really easy, but table mount's not that easy, but you can take a cable, the table mount and take a cable. But actually, I'm thinking we're going to take our patients to the Swan, you know, to our nice bridge. It's close by. I promise you, we'll do that. You know, at least we'll have patients to have, you know, I'll send a picture and spread it out. Because it can be as simple as that. And you know, the adults have worked, I try to say, for ages. So we should really, so I think this is a great effort. And thank you. Let's do it.
It's everybody's effort.
Then I would like to move the next talk on from Elena. Elena is also doing great things for her patients. This is also an international event. Elena,
hello everyone. So I think most of you would have been in this meeting last year when Seljan and I advertised the first International Lupus Patient Day. And despite actually advertising it quite late in September, a meeting that happened in November, I'm happy to report that everything went well, and we had actually good participation from 7 countries on 3 continents. So thank you very much to all who joined the meeting, and of course to your patients. This is really to give you a bit of information about the meeting and to advertise the 2024 International Lupus Day. So really, this was an online meeting, and before actually going ahead and organizing an international lupus patient event, we had some experience of organizing local, I would say, and later on national in the UK, lupus patient days. So, and initially what we've heard from the patients that all they want is actually to meet other patients with lupus and chat, and eventually adolescents and young adults with lupus to hear from their experience. So this is how it all started, and we organized like a small local lupus cafe meeting at Gosh. And in these meetings, we kept collecting feedback from the children, what works well, what doesn't work well, what they want more of, and what they don't want more of. So based on this feedback, we set an agenda for the International Lupus meeting, which was facilitating really by a lupus nurse, Yvonne, who is unfortunately not here today. She's a member of the Lupus Working Party. Lovely psychologists and doctors, and we've been very lucky to have support from Lupus UK, the national charity for people living with lupus. Really, if you can, yeah, yes. So the feedback from the patients was really good, and what they liked most, really, they wanted to see other children with lupus. They liked to hear more about research, and really to have their questions in an informal way answered by the professionals. And this is called Lupus Cafe because it really is not an intimidating meeting for the patients. Some patients would self-select. I mean, the patients who are, very good in, joining meetings and initiating things would join this meeting. But we also wanted actually the shy patients who might, really benefit by participating in this event. This is actually shameless advertising. Please do join our posters, our poster in the poster tour on Saturday. So based on the feedback from the first lupus event, we hope to organize the second international lupus event, English-speaking patients, in March 2024. It's also an opportunity to celebrate World Day. We hope so. Please do, we'll circulate an invite, and please do invite your patients. It would be great if you can also join. Initially last year, we really wanted more patients than physicians, but in the end, we had quite a few clinicians, and it worked really well because the clinicians will turn off the cameras, and the patients will be the stars of the meeting. So please support and do join the meeting and bring your patients.
Thank you very much. Raising awareness about lupus, and we should move forward. Yeah, the next speech will be on our educational pillars. Katarina will talk about knowledge-based exam, finished project.
And it will be very brief. Please, next slide. So it was a big project, as you know, led by Jordi Anton. It's been finished, and we formed a question working group. This group encompassed mentioned persons, Angela, me, Shabnam from Liverpool, Patricia from Portugal, Ayo, and Bridget from France, Iris from Africa. It was led by Angela, me, and big thanks for Shabnam from Liverpool, which was a coordinating member of our group, and she comes from Emerge. So thank you for this big work. We prepared collectively 100 questions focused on lupus, APS, and some interdisciplinary field questions. And KBE on site has been made today.
Thank you very much. They really did a great job in preparation of these questions. Thank you very much. And the next speech will be on educational need related to childhood onset lupus. This is a survey. The results will be presented by Secretary.
Yeah, I am the last speaker, so I will not so time consuming. And this survey was aimed to assess the educational needs within the PReS community. It was developed within the PReS working party and the Emerge group. It was shared using social media and the Emerge newsletter. We get 57 responders, but we failed in a certain way to assess the educational need for fellows, because the rate of response from fellow was quite low. And as most of the physicians are quite experienced in the management of lupus, and they have and the age was quite higher, but it was a starting point, because we defined that no common educational pathway are available for patients, for clinicians taking care of patients with childhood onset lupus. This is how people get the training on childhood onset lupus, and the sources were the most widest, as you can see. And also there is a wide variability in educational sources for continuing medical education. So the result of this survey, even if the number of responders is not so high, it's that people are interested in a common educational pathway within PReS community, both web-based seminars and in-person events like a dedicated educational school. And what is also interesting is that people from a PReS community want to get advice from adult specialists in lupus, and we also provide a list of the most useful topics to be addressed during these courses. So we had a starting point for the next educational activities. Thank you.
Thank you, Eduardo. Welcome. I think we're going to close this meeting.
Yeah.
Anyone, any comments right now? Yes, that's what we'll do too. It's kind of weird to stand here, isn't it? To be the last time presenting this. We're very happy with our new board.
We did a great, yeah.
So thank you all for all, we enjoyed it the last few years, for joining us. Maybe the new ones start joining us.
Please email to me or Selcan if you would like to receive emails from Lupus Working Party. We will come up with the presentations. If you would like to join one of them, please just email us, and we can contact with the respective researcher with you. Okay.
Yes. And you can find us at the website. I forgot to tell you, you don't have to, it doesn't need to be here, but it's on the PReS website. You go to the tab Working Parties, and there you can find the Lupus Working Party, and there you can find TED-Green. We will update with the new board, because it's now just, finished, we just changed. But please email there. If you don't have your email, if you didn't receive anything, please email us.
Our email is on the website. This is the Selcan's email. Please record. She is the new secretary.
You're in.
Okay, thank you.